How was sleeping for you
Good.
the night of the
Good,
adjustment?
and then my shoulder good.
Yeah,
Uh-huh.
that's great.
It's the pain. It's go in hot pain, right? Pero in the after more little, and yesterday little, and today good sleeping.
Good. Excellent.
Only had the pain right here.
Yeah. Is it a little less or the same from, because we only treated it one time, is it a little less or the same?
Okay, here see hot pain.
Okay.
And
Okay.
¿cómo se llama? My glúteo.
Glutes, yeah, yeah,
Maybe for the sciatic.
yeah, yeah. It's gonna
And
take,
I said my husband in the morning, no, I have pain. And sit only this way.
yeah,
Yeah.
Okay.
Pero that's it. Como pain hot or hot pain.
I
Yeah.
got you.
Pero that's fine.
Okay. Yeah, so we're gonna obviously still work on all this here. Take a little bit before we get, as much resolution as I want. You know me, I wanna get it all done at once for everybody. But this will take a few visits to get under control, and I'm happy. It's good. One adjustment in a long time, a lot of progress.
My husband
Yeah.
cut the jar, the grass, la grama,
Okay.
cut today in the morning, and pick up 6.
Okay.
Yeah, the red and only had
A little bit of pain here?
no
No. What about here?
little more.
More. And then let it relax. Good. Good. Comfortable? Nice and relaxed. I'm not ready for that yet. Almost. Yeah. Good. Mas.
Little more in the morning. And next time my chilaquiles.
See my stomach? And I'm gonna make the adjustment like this, okay? Good?
Oh my goodness! Oh, it's too much crack. It's broken my
See now?
today. It's more heavy.
Yeah? That was a different adjustment.
Other day,
Yeah.
it's more.
Different bone. this
Different,
time. Yeah. See?
Hasta mi cabeza no sentí que.
Yeah. It's a lot of noise. I adjusted here, and it was a small, crunch. It was a pretty good one, but that took the pressure off the nerve that feeds here and here.
Oh, okay.
And then today I did this one because this nerve, it's called spinal accessory nerve. It feeds down to here and through here, up here too. So two different nerves
Okay.
feeding the same side. So now we did both of them and we see how it feels. With the day one, I can attach a video here of the day one. We adjusted down here on C6 to take the pressure off the brachial plexus feeding the left arm. Because down here, when this is too stressed open, it's like forcing it back, and let it fall down into my head. Relájate, my, yeah, good, good. Bueno. I like it. And what we do now is, today, it was healing so well over the course of 48 hours that we moved up into the upper cervical, and that's where we found the pressure. And clearly we have some like wedging and irritation that we were picking up on this left side, so we went ahead and made that adjustment to send the occiput back down this way and influence any of the nerves that might be coming out. So when we make a correction over here, we're really influencing the suboccipital triangle muscles, all the facial muscles, all the muscles that control the eyes, and we're influencing a lot of the trapezius muscle that feeds all the way down there, as I pointed out in the video. So again, to address this patient's particular pain, somebody might say, well, how could pain in my foot be coming from my back? And I just want to point out, and in case you haven't heard it before, these nerves right here, so right, these yellow fibers, these are all the nerve roots that come out of our spinal column at the end of, the end of the spinal column and in between all these joints. So in here we have something called, where my index finger is pointing now, is called the IVF, or the intervertebral foramen. And where these nerve roots exit, if there's potential disc injury, right? So if our discs in between a bone are agitated or popping out, or there's any kind of inflammation in these joints or any kind of degeneration in these joints, or even in this particular patient's case, this pelvis is riding high and very, very unlevel and distorted and rotated here. When these nerves are irritated, that starts to make everything down here start to have issues. So again, in plantar fasciitis, what we would have is maybe somebody who has a lot of pain here in the back of the heel. As you can see, this is under our skin, right? If this was a human foot, we're going to have a lot of pulling through here. So if we have that nerve irritation coming from up in this pelvic distortion or lumbosacral area, that could have something pulling all the way down the chain as it crosses the knee to the outside of the foot. And a lot of times that's what we end up with, plantar fasciitis. So what we do in this office, we'll make very specific adjustments to what we call either the navicular bone, the first cuneiform bone, sometimes it's a cuboid, oftentimes it's this talar or this talus bone here. And in this particular patient, we ended up having to do a little bit of work around this arch. A lot of times you'll maybe hear this referred to as the fat pad or the heel pad, but just a little bit of work here, and then through what we would know, right, Kevin Durant, right, the Achilles tendon, we have to be able to stretch that out safely. That's only ever really effective once we've taken care of the nerve root issue down through here. So that's what we did in this case. Again, what we have is a lot of pelvic distortion through here. We have this is rotated this way, and her sacrum's actually rotated back this way. You usually don't see that. And so we have to straighten this out along with the correction in the feet.